It's true. Just keep, even while you're going to see the doctor, you can still hold really positive thoughts. I worked for hospice for 6 years, and I really saw how powerful people's imagination, people's mind, every impression that we have in our mind actually has a physical expression in our bodies. So pay attention to your thoughts.
Exactly, and that leads us really into what we're talking about today, which is pain control with your mind. Mitch and I are wrapping up a UNM continuing ed class right now, self-hypnosis for pain control, pain management. We've had a wonderful time with our class. We have wonderful participants, but we wanted to talk a little bit more about really how much you can do with your mind. Your mind can create pain in your body. That's the kind of pain where, that ache has been there and you've been to the doctor and they say, we have no idea why that's there. There's no lesion, there's no tear, there's no anything, but you've just got some pain. That kind of pain that we're talking about. And we actually have a clip of Channel 6 News?
It's Channel 4 in Oklahoma.
Oh, Channel 4 in Oklahoma. You want to introduce that clip a little bit?
Sure. It's a gentleman named Patrick Coleman. He's a hypnotist, and he talks a little bit about how it all started for him when he was a kid. He had some pain that he couldn't deal with medications, so he learned techniques and imagery and different techniques to eliminate the pain without using medication. And so he became a hypnotist, and now he does it with other people. And he actually hypnotizes one of the people on the news that have this chronic back pain. It's really interesting, and it's great results, too.
Fantastic.
So, let's go ahead and show that clip. Channel 4 in Oklahoma.
Watching Oklahoma's News Channel 4 at 4:30.
And it's coming up right now on Oklahoma's News Channel 4. A hypnotherapist, the fellow you see there on the right, is going to hypnotize Lance West to see if it can help him deal with back pain. Well, also in the news today, painkillers, physical therapy, massage, they're all methods of coping with pain. But one of the oldest pain treatments may be making a comeback. Talking about hypnotherapy. Looking at video from Quail Brook Dental Care. It's a place where patients with pain and anxiety are taught to relax through hypnotherapy. But hypnosis isn't just for dental patients. And joining me now is hypnotherapist Patrick Coleman, who's going to demonstrate his technique in just a second with Lance West, who suffers from back pain. Now, first of all, you got involved with this because as a child, it worked for you.
Very much so. I had a very severe injury to my jaw. And so in 3rd grade, I was taken through training in order to numb it and not have to grow up taking too many chemicals as a child.
Now, this is very much hypno for medical purposes. This isn't the show that you see sometimes in Las Vegas or wherever. This is seriously to help people with pain. You help with a lot of hospice patients as well.
Very much so. You'll find that a lot of them can't have chemicals or they've taken them and are still in discomfort, and you're able to at least get them relaxed and rested.
And Patrick, as I understand it, this is just a partial list of what you can help. Migraines, dental pain, asthma, nail biting, smoking, insomnia, depression, any number of things.
Phobias, fears, psychosomatic illnesses, stress, yes.
Now, our good friend Lance West is sitting here, and Lance is a great guy, but he's just recently started suffering some severe back pain. What caused that, Lance?
I think it's just years of abuse. Played football in high school and doing a lot of crazy things on TV, falling through ice, riding bulls, basketball, bungee, things like that. It's just taken a toll. I recently saw a doctor who had an MRI done, and I'm scheduled to see a surgeon for possible back surgery.
So we're going to see if this will help you at all. Now, on a scale of 1 to 10, as you're sitting there, what is your pain level, do you think?
About an 8.5 today.
Out of a 10?
Yeah, it's pretty bad.
Pretty severe. Patrick, if you would, we're going to let Patrick begin hypnotizing so you can see exactly what's involved. Now, this won't hypnotize people at home.
No.
Okay. All right, so go ahead with Lance then.
Okay, great. If you'll follow my simple instructions, you are about to enjoy a very healthy and beneficial experience. Make yourself comfortable. Pick out a spot just above eye level, maybe under the light, and stare at that spot now without moving a muscle. I'm going to ask you to take 3 long, slow, deep breaths. As you exhale your 3rd deep breath, you'll let your eyelids close down so that then you can have a blank screen. Better picture and imagine the thoughts I wish to convey. Good. Good. Sleep now. Now, 3rd deep breath slowly. And as you exhale, let your eyelids close down. Good. Turn loose, limp, and lazy, every muscle and nerve in your forehead and scalp. Now picture and imagine every muscle and nerve in your forehead and scalp losing tension, like rubber bands losing tension. Send this in a wave of relaxation down through your face.
Okay, we're going to check back with Lance and see how he feels after being hypnotized later in the show. Plus, can it be done? Is Lance West falling under the spell of hypnotherapy? And will it help his aching back? Answer still ahead. And he's used to flying in 3 different directions at once, but today Lance West is getting focused on getting rid of his back pain. Is hypnotherapy possible? We're going to check in with Lance to see the results coming up.
Shh, Linda's over there with Lance West being hypnotized. Back to you, Linda.
All right, thank you very much. And If you're just joining us, Patrick Coleman, who is a hypnotist, has been here with us. He's a medical hypnotist who helps hospice patients and others deal with their pain. And we brought in Lance West, and earlier in the show, he hypnotized Lance, trying to help him deal with chronic back pain that has really gotten much worse lately. Lance said on a scale of 1 to 10 just moments ago, he was at about an 8.5. Now, Lance was afraid that he couldn't be hypnotized.
That's what he said. He said he was classified with ADHD.
Yeah.
However, this is a natural state of mind available to every human being on the face of the planet.
How can you tell he's hypnotized?
There's 5 physical states of physical recognizable states.
But I saw you pinching him.
Okay, here's a good one. Breathing deep and rhythmic, you may feel a little pressure, you may feel nothing at all. Drift even deeper into relaxation all the way down now. And that's just a natural phenomenon, psychoanesthetics. That's how is what medically it's termed. And that's how we deal with patients. And I'm pinching harder as we're talking, and he's feeling even less and less and less.
Go ahead and wake him up.
Okay. In a moment, I'm going to count from 1 up to 5. On the number 5, your eyelids open. 1, gently returning to full awareness. 2, feeling wonderfully good in every way. 3, eyes begin to feel sparkling clear. 4 and 5, eyelids open. Fill up your lungs. Take a deep breath and stretch. Come all the way where? Like, yeah.
Good morning. I have never seen you that quiet in your entire life. I've worked with you for more than a decade.
It's a lack of sleep, I think.
Well, I think you just got some right there. How long do you think you were asleep, if that's what you want to call it?
I feel like I've been resting for 2 or 3 hours.
Really?
I feel really well rested, actually. Yeah.
Good.
Before, you said that you were in pain at about 8.5 out of 10 with your back. What would you describe it as being now?
Sitting right here, I don't feel anything. I feel fine.
But before, you felt what?
Well, when I climbed into the chair, I had that initial pain. Getting into a chair like this is difficult, so there's pain initially, but it's hard to say until I get up and move around
So stand up,
to determine what
sit
the pain
back
is.
down.
Zero.
How does that work?
Okay.
How is that possible? Because I believe Lance West. I trust him.
Okay, good. And I do too. I must say this though, it doesn't mean that you should stop seeing your doctor. You got to go see it and make sure that that it's handled correctly by medical professionals. This is psychoanesthetics, medically termed. I've done several natural childbirths, no chemicals, no pain. The synapses does not occur between the 3 main neurons. There's no polarity shift on aggressive signals. They're just not sent. And so you can control comfort levels.
So basically, Patrick, what you're telling me is that if he's got a physical back problem, he still has that. He's just not feeling the pain.
Right. And he can do for himself what I just helped him do. Just a quick relaxation technique. It really takes 1 minute maybe.
All right.
I heard everything you were saying.
Sure. Yeah.
Everything? No.
Everything.
Lance, thank you so much for joining us. And Patrick, thank you very much.
Yes, ma'am. Thank
we
you.
were fascinated when we heard about this, and it's certainly something that I think a lot of people might benefit from.
Mainstream now.
Thank you very much.
Thank
Now, hypnotherapist Patrick Coleman works at Quailbrook Dental Care, but also treats other patients for pain, depression, or addictions. We have a link to his website and phone number at KFOR.com. Lance, thank you. Patrick, thank you.
Thank you.
Bravo, Patrick Coleman. I really, really like the way he really stressed that it's a natural state for everyone, and that, take yourself to a medical doctor, continue to get all of the professional medical treatment that you need, and use this as an adjunct in your pain management system.
It's really, I know you've said it and Patrick said it, we can't reiterate it enough how important it is to keep seeing your doctor. I know a lot of times when I work with clients with pain, instead of the pain, we can give them a signal. You'll feel a buzzing in your right hand. And as long as they put their attention to it, they feel the buzzing, and they have to, in that moment, put their attention to it and deal with it, whether it's the medication or seeing the doctor again. So they don't really have to go into the pain, but they really have to have some signal, because we can eliminate the pain, and if there's a problem underlying the pain, then a brain tumor or something, a broken bone or whatever it is, then you have to deal with that. So again, with my clients, I'll give them a signal that when the pain is coming, you'll get a buzzing in your hand, a tingling, and that's your signal to do something and act on it right then before it gets into the pain. So great. I'm glad he said something about that. That was really good.
You know what I thought was kind of funny, Mitch, is, and this is what we deal with a lot, and when we work with people with the mind, or we tell them what we do, is the lady newscaster, she used some terms that were just so, this is what gives working with your mind kind of a bad rap sometimes. She called it falling under the spell. Ooh, there's no spell. If I could spell people, I would have a different life than I have right now. I have a beautiful, wonderful life. But yeah, like I've said before, Gabriella's room would be clean.